Hi, my name is Ebony and I am here to talk about diabetes. There are two types of diabetes. Diabetes type 1 is caused by pancreatic insufficiency. Essentially, the body's pancreas is unable to make enough insulin to support the body's needs to break down sugar. Diabetes type 2 is caused by resistance to insulin that the body produces or insulin that the body is receiving artificially. The case that I have to present is a patient that reported to the emergency department where I work at. The patient has a history of type 1 diabetes and had diabetes since he was approximately 11 years old. He had been taking metformin on a weekly basis and was also on an insulin pump. It is a device that is attached subcutaneously, and the way that the patient uses it is that he checks his blood sugar in the morning, which is the fasted blood sugar, at bedtime, before meals, and after meals. The reason that the patient covers or checks his blood sugar before and after meals is because he's giving himself a bolus, which is some insulin to cover all of the carbohydrates and sugars that he just ate or is about to eat. Most patients are given a pamphlet and handouts and taught by diabetes educators and their physicians on how to properly track and self-medicate through the insulin pump. There's also a lot of close monitoring. So back to the patient. When he presented to the emergency room, he said, "I just don't feel good." And a patient who normally has diabetes is very in tune with how they're feeling and what's normal for them and what isn't normal. He did have a history of hypertension, which is high blood pressure, and had been taking his scheduled medication the way his physician prescribed. Upon assessment, we did check his blood sugar for ourselves because his monitor was saying his blood sugar was approximately 200. Normal blood sugars are between 70 and 110. For this patient, he liked to keep his blood sugar in between 100 and 120. That was his norm. So his meter reading 200 was not normal. And when we checked it, we actually had a reading of about 575, which meant that the patient was currently experiencing diabetic ketoacidosis. According to the Mayo Clinic, diabetic ketoacidosis is caused by it's a complication of diabetes, which is caused by the body's excessive production of ketones, which is produced by the kidneys. This is one of the things that can cause a patient, if it gets too high or too low, to go into a coma. So we immediately took the insulin pump off of the patient, covered him with 25 units of Humalog, which is rapid acting insulin, and also put him on an insulin drip. Now, one of the things that we were wondering was, had the patient developed a resistance to the insulin that he had been taking? Had he developed type 2 diabetes? Were we unaware? Because his pump had been programmed for his type 1 diabetes that he had been living with. So all the extra or the elevated blood sugars that he had been experiencing were not covered by the protocols listed on his pump. When we did a more thorough background of the patient's medical history, we actually came to learn that he had recently been diagnosed with pneumonia and bronchitis. So he had been taking steroids, which can increase your blood sugar. Now, the urgent care clinic that he went to was aware that he was diabetic, but did not educate the patient on the proper way to cover his blood sugars based on the way that the steroids would be affecting him. So this caused the patient, for I believe 2 weeks is how long he had been experiencing this, to create a cascade of effects, which did essentially cause him to be admitted into the ICU and receive the proper level of care that he needed to regulate his blood sugar. So in this case, the patient had not developed a resistance or type 2 diabetes. He still only had type 1 diabetes, but he was really sick. And this is why it's so important for people to understand and ask questions when going to any physician. If it's not your normal physician, ask questions, especially for our diabetics or people with high blood pressure. You want to know what medications they're giving you and how they're going to affect you, whether it be short-term or long-term, because a lot of medications can cause side effects like the steroid increasing your blood sugar. Just like if a patient suddenly develops an asthma attack or some kind of bronchitis and they are given a breathing treatment and they have a cardiac history, breathing treatments can create or cause tachycardia, which can create some discomfort for patients, especially if they're in heart failure. So always be very mindful of your medical history and always be on top of notifying your physician if you do see an urgent care clinic, because it's not 100% their fault. They don't know your complete history. So always, always, always make sure that after you see a physician that's not your normal at an urgent care clinic or the emergency room, you follow up with your primary care doctor.